Hi everyone, it's Dr. Horzempa. It's been a little while since I've done any posts, but I wanted to just talk about something that's been in my mind recently. And it's the concept of doctors becoming or learning from, the whole biohacking community. And if you've never heard of biohackers, they're a really diverse group of people who tend to have non-medical backgrounds who are trying to basically look at the body like a system and apply kind of an engineering type approach, systems biology type approach. And this is being called biohacking. And, honestly, I think as doctors, we should be biohackers. We should be constantly looking for, new methods, new treatment modalities, new diets, new anything, to try to improve the system that is the human body. And I feel like this is kind of a concept that I feel is lost on the general medical community. I don't think there's a lot of people doing self-experimentation who are physicians or healthcare providers. And I don't think that they're looking at it as, this is a system that we need to hack. So, personally, I definitely consider myself to be a biohacker. I am always doing some kind of experiment, trying to, find a better way to do things, and experimenting with different measuring techniques, different labs, experimenting with, a continuous glucometer, experimenting with ways to measure sleep quality, ways to measure stress. All this I feel is part of the evolution of what I would consider to be a responsible physician or healthcare provider. And I think, if you're looking for a doctor, I think it's a reasonable question to ask as to what they're doing. What are they doing in their own life? Not only for their own health, but what are they experimenting with? And to be clear here, some of this experimentation may never make it to my recommendations for patients, but some of it might. Now, certainly, I would never base a treatment protocol entirely around my own experimental, studies on something. You want to also have good science backing this up. You want to have mechanisms. But, I think it's a useful thing to get some answers for things that sometimes science has trouble getting answers to, that can be very easily obtained by just doing some self-experimentation. For instance, I've been wearing a continuous glucometer and testing different diets, and seeing, well, where am I on this particular diet versus this diet? Which diet has the least amount of glycemic variability and the lowest fasting glucose and the lowest glucose average, and all these things that I think are important for determining the efficacy of a diet. And that's just one example. So, physicians and doctors who are listening to this, start experimenting. And patients, if you're looking for a doctor and your health is important to you, and making sure that your health is optimized is important to you, I think it's a fair question for your doctor to ask. So I hope this has been helpful. Have a great day.